What are the specific considerations and approaches in assessing adult clients? What kind of tools can we use to understand their needs and strengths? Today, we will talk about clinical assessment of adults. When assessing adults, social workers must account for the intricate interplay of cultural, ethnic, and life experiences. Multicultural sensitivity is crucial for effective engagement. The culturally tailored questioning can be used as part of a comprehensive assessment in order for us to be able to capture life experiences, coping mechanisms, and adult-specific dynamics. Diagnostic systems like DSM-5 guide social workers in assessing mental health problems and making accurate diagnoses. The DSM-5 offers widely accepted descriptive criteria emphasizing a dimensional and lifespan approach. It helps identify serious mental illnesses and associated risks. Training in DSM can ensure that it's properly used in the clinical practice. The DSM, which is primarily designed as a psychiatric textbook, faces criticism in social work. Practitioners argue it may marginalize clients through diagnostic labels, potentially disempowering them. Some therapists even question the DSM's utility, emphasizing behavioral specifics over labels. Critics highlight the DSM's questionable research validity and reliability, with some pointing to its socio-political influences. Historically, the DSM was perceived as such that would not allow to fully use the person and environment concept, which is core to social work. At the same time, the person and environment assessment approach lacks empirical support, while the field is actively integrating the evidence-based practices. The DSM-5, an evolution of its predecessors, incorporates a person and environment approach, emphasizing related disorders, clustering, dimensional classifications, and cultural considerations. However, there exists a concern that no future editions may fully address all practitioners' concerns about psychiatric diagnosis. Still, the DSM, a predominant diagnostic system in mental health, is essential for social workers who constitute a significant portion of mental health providers. It's vital for clients' communication, insurance reimbursements, and collaboration with other professionals. The DSM details symptoms, risk factors, and diagnostic features influencing social work assessments. In social work, assessing major mental illnesses in adults is a critical step needed to develop proper treatment plans for the clients. Social workers conduct evaluations of serious disorders such as schizophrenia, bipolar disorder, and other neurocognitive issues. Proper diagnosis ensures individuals receive the appropriate treatment and care that they need. One of the tools that can be used in the process is the Mini Mental State Examination, MMSE, designed for both clinical and research settings. The MMSE offers a concise yet comprehensive evaluation of cognitive impairments. Its breadth encompasses orientation, attention, and language, while the application takes less than 10 minutes. The MMSE has the 11-item scale to detect cognitive difficulties in special populations, such as older clients or clients with head injury. The structured clinical interview for DSM-4 Axis 1 disorders, SCID-1, is another comprehensive diagnostic tool updated in line with the DSM-5. SCID-1 is a comprehensive tool that requires the use of clinical judgment. When addressing adult clients' concerns, social workers often deal with such prevalent issues like depression, anxiety, and trauma. Rapid assessment tools tailored for specific diagnoses play a pivotal role in assessment of these conditions. These instruments, both valid and reliable, serve as an initial diagnostic step. If concerns arise, they pave the way for more in-depth evaluations to confirm the diagnosis. Such measures are also very useful for monitoring the outcomes of the interventions. Major depressive disorder, MDD, is characterized by a depressed mood or a lack of interest in activities causing significant impairment. Symptoms include sleep disturbances, weight fluctuations, and suicidal thoughts. Persistent depressive disorder, on the other hand, has a continuous depressed mood with similar symptoms lasting at least for 2 years. Accurate assessment tools and clinical judgment are crucial for diagnosis of adult depression. The Beck Depression Inventory, BDI, developed by Aaron Beck, is a widely used tool for assessing depressive symptomatology in adults. Consisting of 21 items rated on a 4-point scale, it evaluates the intensity of depression. BDI-2 scores range from normal to extremely severe levels. The PHQ-9 is a self-administered tool primarily used for screening the severity of depression. Comprising 9 items, its scores can range from 0 to 27. A cutoff score system classifies depression levels from mild to severe. Its high sensitivity and specificity make it a reliable tool for identifying major depression in adults. The CESD-R is a renowned, famous 20-item self-report scale used to evaluate depression. CESD is a versatile tool. It has proven its reliability and was used across different populations and different ages and ethnicities and underserved populations. Both the CESD-R and the PHQ-9 are very popular and accessible tools in the public domain. Anxiety disorders are prevalent and often intertwined with depression. Their genetic roots show considerable overlap. The DSM-5 emphasizes the nature of anxiety disorders as stemming from excessive fear and anxiety. Anxiety symptoms span from restlessness and sleep disturbances to irritability. There is a range of different types of anxiety disorders recognized by the DSM-5, which is why we need proper tools to accurately diagnose them. The State Trait Anxiety Inventory, or STAI, is a widely recognized tool for assessing anxiety. It's a comprehensive 40-item scale that measures feelings of tension, security, upset, and others. The scale has been rigorously tested and validated. The Generalized Anxiety Disorder 7-item scale can be used for a more rapid assessment. The Panic Attack Symptoms Questionnaire can be used to assess clients at risk of experiencing panic attacks. The 33-item instrument quantifies the severity of symptoms during a panic episode. With its high reliability, it's a key tool for assessment of individuals prone to panic attacks. Trauma and stressor-related disorders are a set of psychological responses to distressing external events or stressors. These disorders sometimes manifest with symptoms overlapping with those of anxiety, obsessive compulsive, and dissociative disorders. It is important to select effective assessment tools to accurately diagnose the conditions experienced by our clients. A range of tools has been developed to diagnose and monitor trauma and stress-related disorders. The PCL-5 aligns with the DSM-5 criteria and can be tailored for various purposes. The Acute Stress Disorder Scale is specifically designed for acute stress symptoms. It has a high reliability. The Trauma Symptoms Checklist 33 and 40, meanwhile, can assess both childhood and adulthood traumas, providing clinicians with a comprehensive view of the patient's trauma history and current state. Personality disorders manifest as deeply ingrained patterns of behavior that can disrupt an individual's ability to function in daily life. They are often categorized into 3 distinct clusters in the DSM-5. These disorders often require extensive therapeutic interventions. Many people with personality disorders need a lot of help and support to reduce the risks such as harm to themselves and others, or engaging in risky behaviors of substance abuse. Structured and standardized assessment tools such as SCID-2 and the Self-Report Standardized Assessment of Personality Abbreviated Scale provide robust methods for accurately diagnosing personality disorders. The SCID-2 is recognized for its detailed approach, while the abbreviated scale offers a quick method for general personality disorder screening. For a deeper assessment of an individual's personality, tools like the Millon Clinical Multi-Axial Inventory and the College Access to Inventory offer comprehensive assessments based on DSM-5 criteria. Additionally, the DSM-5 provides online disorder-specific assessment measures. Substance-related disorders encompass a spectrum of issues from misuse to addiction that can deeply affect an individual's life. The DSM-5 provides detailed classifications for substances, and it's critical to understand that substance use can be intertwined with other mental health disorders, specifically alcoholism, a widely recognized medical disease, often occurs with significant health and social challenges. The DSM-5 offers a multifaceted approach to diagnosing substance-related disorders. It's crucial to understand the difference between use, withdrawal, and substance-induced mental disorders. Determining the severity of substance use is vital for appropriate interventions. This is usually done by gauging the number of concurrent symptoms. Gambling disorder is also based on addictive behaviors, even though individuals addicted to gambling may not use psychoactive substances. Accurate assessment of adults is crucial, especially for addressing substance-related disorders. And various tools such as CAGE-AIDS, brief questions, and detailed alcoholism screening test offer clinicians very valuable insights into client substance use patterns. The comprehensive SBIRT approach is another useful tool that is used by practitioners to diagnose and intervene effectively in cases of substance-related disorders. The aging population is growing rapidly, and with it come unique challenges. Older adults often grapple with emotional issues that are very similar to younger generations, but conditions like depression and neurocognitive disorders become more common as we age. When we perform the assessment, it's essential to differentiate between actual medical concerns and the natural aging process. For example, a decreased sexual interest might be natural for some older adults and may not necessarily represent a symptom of depression. Depression in older adults can manifest in familiar ways, but it can also be accompanied by memory loss and cognitive challenges. Due to these overlapping symptoms, there's a risk of misdiagnosis. The Geriatric Depression Scale offers a tailored approach to assess depression among older people. Older adults' functional status or their ability to manage daily tasks and self-care is a crucial area of assessment. Tools like WHODAS 2.0 offer insights into seniors' cognitive and functional capabilities, providing a comprehensive view of their well-being. In modern healthcare settings, quick and efficient assessments are becoming more vital. Tools like OQ 45.2 offer a way to track treatment progress and provide real-time feedback, making it easier for practitioners to adapt and improve their approaches. In this video, we've examined adult client assessment. We reviewed assessment techniques tailored for adults that help understand their needs and challenges. We discussed direct interview questions and various standardized measures and rating scales. It's imperative that we use the strength-based perspective in the work that involves assessment. Social work is not just about identifying issues and deficits. We also focus on recognizing and leveraging the inherent strengths and resources that individuals possess. Finally, as we move forward, it's essential to remember that the key to effective social work lies in continuous learning. Therefore, we should use every opportunity to practice and hone our assessment skills.